It's official. Widespread booster shots are coming for many fully vaccinated in the U.S. While people with weakened immune systems can already get boosters, the Biden administration is now recommending everyone get one starting 8 months after a second dose of Pfizer or Moderna. Johnson & Johnson is expected to follow close behind. The rollout will start September 20th with frontline health workers and nursing home patients and staff first in line. And while that may be of comfort for some, the fact is 40% of the country still hasn't even gotten a first dose of the COVID vaccine. And as the Delta variant spreads, it's mostly the unvaccinated who are dying and filling hospitals in COVID hotspots across the country, with intensive care units in the 5 hardest hit states now past 90% capacity. That includes Alabama, which now has more ICU patients than beds. But what's worse is that a growing number of those patients don't even have the option to get vaccinated and little to no control over their ability to stay safe. Over the weekend, hospitalizations among kids reached a new high of just over 1,900. And as they head back to school without federal safety mandates, it's every state, school district, and student for itself. Some schools in states like Texas and Arizona, where school mask mandates are or soon will be banned, have already had to close, with hundreds of kids testing positive after just a couple of weeks back in classrooms. And just last week, California became the first state to require vaccines or regular testing for all teachers and education staff, and their school mask mandate is still in place. But Massachusetts is looking unlikely to follow suit, as Governor Charlie Baker told me and Marjorie Egan on Boston Public Radio earlier today.
We did make a very strong recommendation, especially for that K through 6 population, which does not have access to vaccines yet, but we expect will at some point. And based on what we've heard from our colleagues in local government, virtually every K through 6 student in Massachusetts will be masked, and we also believe that virtually every unvaccinated 12-year-old to 19-year-old will be masked as well.
Many, but not all. So will it be enough to keep kids safe? I'm joined by Dr. Carole Allen. She's a pediatrician and president of the Massachusetts Medical Society. Dr. Allen, it's a pleasure to meet you. Thanks for being here.
Thank you, Jim, for having me on.
You heard what the governor, or at least part of what the governor had to say. You and the Mass Academy of Family Physicians do not agree. Why?
We agree that younger children should be masked, as he has said, but we actually believe all children and all people in schools or entering schools should be masked, partly because it's simpler. It's a more even way to go about it, and because the Delta variant is unpredictable and rising right now, and this is a way to mitigate the risk for every person.
We should be clear, by the way, even with those younger kids, the governor is not mandating masking. He is urging masking, which obviously still leaves it up to the individual. I don't want to speak for the governor, but I'll try based on what he told us today. He would say vaccinations are high here, hospitalizations are low. He cited the vaccination rate for 12 to 15-year-olds, 65% compared to the national 45% level in that same age group. He says we are different. Is your contention we're not different enough to stay mask-free, or at least have the right to stay mask-free?
I think we are not different enough. That really we need much higher universal rates of vaccination. And remember that the younger children do not have access to vaccine, and there is cross interaction between students, between faculty, between other school personnel. So the risk is there. It may not be as high in our state as other states, but why should we not protect our kids so that schools can be open and stay open?
If you had school-age kids and they were going to a school that didn't require masks, what would you do?
I would urge my children, or my grandchildren in this case, to wear a mask. But I think when some children are masked and others are not, it exposes them to the possibility of discrimination, of having reactions from other kids. And some children who are fully vaccinated still feel more comfortable wearing masks. I've heard that from my own grandson. So why should we mark some children as vaccinated and some as not, when it's so much simpler and easier to administer to have everybody wear a mask?
Let me ask you a variation on what I just broached with you. You have a patient who says, I'm really nervous about having my kid go. He or she is going to wear a mask, but I'm worried that a lot of his or her classmates are not. What do you tell that patient?
Again, I would hope that there is a universal requirement for masking.
But if there's not?
If there is not, I think they have to use their own best judgment. The bottom line is that children should be in schools. The schools need to be open. The kids suffered greatly during the pandemic from being out of school, and they really, really need to be in school. So whatever can be done to keep kids safe needs to be done. And again, a policy makes it simpler. And I would hope that we get there.
You know, the Mass Teachers Association, I'm sure you know, voted that there should be not just a mask mandate, but a vaccination mandate. The Mass Medical Society hasn't gone that far yet. Why? What is required of teachers is really not exactly our purview. We do have a policy recommending that all healthcare personnel in all settings should be required to be vaccinated. And we just feel that going to the schools is a little beyond our own purview. However, I do think it is important that every adult and every person eligible for vaccine who is in schools be urged and strongly urged to be vaccinated. Yeah,
that's the first line.
I want to add one thing to this conversation in terms of whether it's masking or vaccination. A guy called our radio show today and yesterday who used to be a selectman in a small town, and after making the point that he said a lot of local officials aren't that qualified, let's be kinder, even if they are qualified, a lot of them don't have the resources or access to the scientific expertise to make informed decisions. So his point, yet another good reason for the state that does have the resources and the know-how to do it. Do you worry as a doctor and a leader in the medical community that this demented anti-science, anti-public health sentiment that is sweeping some parts of the country is going to trickle down into a lot of other things that you and your colleagues do, Doctor?
That's always a worry. It is discouraging to notice that many people seem to be questioning the value of science and medicine. But on the other hand, look how much progress we made in developing these vaccines.
Indeed.
And so I feel that, and the physician-patient relationship is important. And that is a way that doctors can influence their patients. Yeah. And I've had success with my own patients and their families. I think it's possible to make people believe again in science.
One last thing, how worried are you about the fall? We have, again, mixed masking and vaccine requirements. We have viruses, from what I understand, that generally expand in the fall in colder weather anyway. We have the Delta variant. Just stepping back a little bit, how worried are you about schools in the fall?
One of the things I've been saying is that children are going to get sick when school starts. They always do every fall. And so we need to be prepared for that. We need to figure out how do we identify who has which infection and not keep kids needlessly out of school, but advise parents not to send a sick child to school. And so testing may play into that. But again, if we have masks required in schools, children are less likely to spread other infections among themselves as well. And that may also help to mitigate this issue that you just raised.
Dr. Allen, good to meet you, and thanks for your thoughts. We really appreciate it.
Oh, thank you very much, Jim. I enjoyed being with you.
Thank you.